das heißt, kann nicht schief gehen.
You first?
Yeah. I go only one go a little bit back.
โอเคครับอย่างนั้นเดี๋ยวขออนุญาตเริ่มต่อนะครับจากช่วงแรกนะครับหลังจากเบรกมากันเรียบร้อยแล้วนะครับออนไลน์น่าจะพร้อมนะครับเดี๋ยวจะเริ่มต้นจากการตอบเซสชันคำถามเมื่อกี้อีกสักเล็กน้อยนะครับเพื่อให้ครบทุกคำถามก่อนที่เข้าในส่วนของเซสชันต่อไปในการบรรยายนะครับโอเคครับ
So hello again. We should answer questions now from the online attendance, and there was one question again: if Shockwave can create necrosis of the bone. And as I formerly mentioned, the opposite is right. Shockwave cannot create bone necrosis, but it can create new growth of the bone, as I can show you later. Shockwave is a mean to heal delayed bone healing or to heal pseudarthrosis, but there's no mean, especially with the new machines, that you can cause bone necrosis by shockwave. Okay. The next question is from a medical field. In case of tendon or muscle injuries such as tendinitis and tear, which technique and frequency of shockwave therapy is the best way for treatment? How often and how long for treatment it could be effective? Can shockwave therapy use at the same time with other modality treatment such as radio frequency? Okay. I always recommend, if you, for any disease, tendon rupture, insertional point, injuries of the tendon, and you have a good technique, go on using this technique, no problem. And you can use shockwave as an additional tool, or probably you can use shockwave alone. How to treat? It's, as I said it in before. If you use the Shockwave machine or the other machines too, this vario mode is a speciality of Shockwave. You usually have a linear technique in the other machines. Put on my recommendation for beginning, or for the best frequency for all of the indications. My recommendation is 4 Hertz. Don't go faster than 6 Hertz. That's my general recommendation for all treatments. And you find the point where the pain is, or where the injury is, the muscle rupture or the tendon rupture, and you put your treating head on it, and you put energy on it, and you wait till the patient feels a certain pain or feels the pressure. If you have a disease, sometimes it's like that. If you have a big muscle rupture or something like that, and you hit the rupture, that the patient probably doesn't feel any pain. So then you should use intensity that's around 0.3 up to, let's say, 0.5 millijoule per square millimeters. And if you use the Shockwave device, that's between 15 and, let's say, 18 or 20. And then you do the treatment usually once a week. If you have an acute muscle rupture, I personally do it more often, twice a week or 3 times a week, that depends. And you don't have to do more in these injuries than, let's say, 6 treatments. And then you wait for at least 4 to 6 weeks, and if there is pain remaining, or if the outcome is not so as you want, you do another series of 4 to 6 treatments. That's my recommendation for tendon or muscle injuries.
I want to add one thing from the technical side. Dr. Lang said, okay, your recommends a rather low frequency. Our unit has a frequency until 25. We said, for example, he mentioned frequency 4. And I want to add why. If you go to a very high frequency, from the technical side or from the physical side, it creates air bubbles, and these air bubbles, they are resistor or resistance for the energy. Cavitation, like we call these air bubbles, you are losing energy because a shockwave can only pass through water or fluid, not through air. That means if you are higher frequency, you create air bubbles, and you are not effect to reach the region of interest. So please don't use frequency 20 or 15. This is really too fast. Use a low frequency, like Dr. Lang recommends, frequency 4. I said to 6 should be okay.
Another question is if you can apply shockwave in children. Yes. In children you have to be a little bit careful because the noise of the machine might make a child fear. So when I treat children, my recommendation from the physician side is you put on an energy and a frequency similar to adult persons, but you show it on your own body. You put the handpiece, when you want to treat children, you put it on your own body in the beginning and show the child that nothing serious happens. And you have to be a little bit careful with energy because the amount of tissue in the child is lower than in an adult, depending on how old the child is. And my experience is the deeper the focus point is, the more energy you can use. So if you treat a child, you might not reach a very deep focus because there's the child and the thickness of an arm or of a leg is much more thinner than in an adult. So don't start with high energy. Their recommendations in the machine are for adults. So even in childs, it's very important to start with very low energy and face the child, look in the eyes of the child, and if you see any pain reaction, you might stay on this intensity, don't exceed. That the child feels no fear, and as I said in the beginning, start the treatment at yourself. Does white focus always also cause swelling, redness, or inflammation after treatment like other shockwave? If you use properly gel, and if you use our machine, the swelling, redness, and other side effects are for sure not in that way like in other machines. For example, a radial machine, you have the tip of the energy point directly on the point of the entry. So if you use radial shockwave and keep on the point, and you do, let's say, 500 pulses, you take the machine away, you always have a swelling and a reddening because the energy is just on the skin. If you, and in addition to that, what Peter before said, if you put a very high energy on a radial system, you reach a little bit deeper tissues, but The problem is that you have most of the energy on the skin, and so you might cause swelling and reddening and pain on the skin. Okay, so if you use wide focus system in the proper way, the chance that reddening and swelling and inflammation after treatment occurs is not so much likely than in other machines, and if it occurs, it usually goes away within 1 hour, 2 hours.
โอเคครับก็เรียบร้อยนะครับขอบคุณมากที่แบบมีคำถามเยอะมากเลยนะครับในการถามในเซสชันเมื่อเช้านะครับก็เดี๋ยวต่อไปจะเริ่มในส่วนของเซสชันที่2นะครับก็เดี๋ยวขอเชิญนะครับดร.แบงค์
So we can go on. See, this way. So question we had. Now I want to introduce our Shockwave, our 3i, and you see we have different applicators. We have a standard, we have 3 applicators, but also we have these big ones down here. Where is this? Oh, okay, these are the 3 standard applicators here, 1, 2, 3. And here we have the big one, 30 and 35 millimeter, I think, which you can use if you have bigger areas, but the depth is, of course, then it's not so big. If you use a bigger applicator, the penetration is around about 15 to 20 millimeters, and these are these 2 applicators. Then you have our set with a handpiece inside our 3 applicators, normally if you standard. Then we have also foot switch. A foot switch you can put the energy up and down first, and you can also the vario modes. Oh, thank you. You can go on with the vario modes. Here is a foot switch, put up and down. If the patient lays on a bed, let's say, and you treat heel spore, then you can put the foot switch direct close to the bed, not necessary to go always to the machine. You can control everything by that foot switch. Then we have also a transportable system. Sometimes 2 doctors share one machine together, so can bring it easily from one house to the other, praxis, for example, or clinic. And here you have the standard equipment. This is our porter equipped with a machine and all the small suitcase with the applicators. Everything complete. You see here, Shockwave 2i. It's a smaller version of the Shockwave who has only one vario mode. This is this triangle mode and the linear mode. Vario mode only one, but this is easy usage. Some doctors also, they say, no, I don't want to spend such a high investment. Most time doctors are very rich, but some maybe drive a big car, American car. I know a doctor who drives a big American car. So maybe he saved the money and he used the 2i. Yeah? Also, you can treat all patients, but you have only one possibility, that is only one vario mode. So, 3i innovations, once again, which is very important, and I want to repeat it. Wide focus. Wide focus is a focus system and a radial system. One 2-in-1, we call it, because we know also some companies, they sell 2 units, a focused one and a radial one. With our system, with wide focus, you have 2 systems in 1 machine, which is, my opinion, more effective. We have, due to the high ceramic projectile, and we have these different modes, these different vario modes. We have a special construction that we have a very high energy. The patient tolerates the energy because we have our different vario modes. And I think that is our big advantage from our machine. You need no 2 systems, you only need 1 system. Therefore, we are very proud to present you this machine. It saves money. It saves you 1 machine because you can treat with this machine easily all kind of indications, and we have a focus as well. And our wide focus, I told you already, you don't have necessary to localize the depth of the indication, because our focus goes maximum 55 millimeter in the tissue, which is normal, more than enough. If you need to treat a bigger area, you take these 35 millimeter diameter, our bigger applicator, so you can treat also everything on the surface, let's say maximum 15 to 20 millimeter in the tissue. About the warranty period, we have 2 years warranty, standard warranty in all parts. If you change the revision kit means the tube, including the projectile, you have 1 year warranty, but no limit of the Shockwave numbers. You can treat 2, 3, 5, 10 million within 1 year. We from the company give no limit, unlimited Shockwave. That's it from my side. Maybe what is we all advantages, high energy, wide focus technology, is everything written down, which I already explained to you. Once again, ceramic projectile. We have also what I forgot to mention is if you create a Shockwave and you have 2 big negative focus, you see the gray one here, this is the negative focus part. If we don't use not ceramic, we have these big negative parts which creates a lot of pain in the pain, or more pain, I would say. But with this is also effect of this projectile, of the ceramic projectile. We have only a very small negative pulse, and which creates less pain than a big one. So then we have the invert mode. This is very new. Before we had only the triangular, linear, and the pulse mode. That means if the energy is high, the frequency is low. Is the frequency high, the energy is low. Why? That the patient or the cells have time to relax. We don't want to give high energy and high frequency on the same time. It's inverse, always high energy, low frequency, and the other way up. So that is what most doctors now are using. Also Dr. Lang will tell you later about this big advantage to use our so-called invert mode. Because, as I told you, frequency up, energy down, and reverse. This we write, but we will tell you. You see all the modes here. Linear mode, then we have the triangular mode, We have the pulse mode, for example. Some doctors prefer the pulse mode. We are 5 seconds maximum energy and frequency, 5 seconds low energy and frequency. Triangle mode, frequency and energy at the same time in the maximum, at the same time in the minimum. And what we find out, the most used is the invert mode, because energy up, frequency down, and also the reverse. This is now the using of the machine, but we have time now to do later on the practical use on the machine. And I think there are quite a lot of questions if we use the machine direct. We have, of course, touch panel, but I don't want to speak here about the practical use. I think it's better to do it on the machine, but I can go through fast. You can adjust everything here, but better is to see it live and to try it. And now we have time. Question about the machine, about the usage of the machine. Anytime you can ask whatever you want. I think we can ask all your questions, because it's important to know the details of our machine, to know our advantages, and to compare it with the other machines on the market. And you want to maybe about this mode, special invert mode, maybe now the experience from the doctor side.
The question is, how long should you use Shockwave for one area? Not more than 1,000 shots on one point. As I will say later, I do not stay on one point for such long in the regular treatment. But I showed you the picture with the experiments at the beginning, and it was found out that if you do more than one shots on one point, the effect gets worse. You get more damage of the cells if you use more than 1,000 pulses on one point. So that means I always move a little bit the head. So when I use 2,000 shots, I never go more than 1,000 on one point. Okay? But if you ask exactly, this first real experiment showed that the best frequency is 4, the best energy is, I only say it like that, 0.2, and the best number of shots to use the effect on one point is 1,000. Okay? That doesn't mean that you can do more shots. If the area is bigger, you can use 3,000 shots, let's say. It costs time, but if you have to treat a bigger area, you need more shots. But on one single point, it's recommended not do more than 1,000 shots. And how young was the youngest child you treated? I didn't treat a baby, that's what I know. But if I think over it, maybe, but I'm not really so sure, but I think around 5 years. But it's always when you treat children, and I'm a surgeon, I often do harm on the children when I do operation or when I suture a wound or anything like that. You always have to be very calm, and you have to calm down the child. And it's with the shockwave therapy too. You have to be respectful with the child. what are the side effects or possible adverse effects of shockwave? It's true like this. If you use too high energy, but I mentioned it before, you can cause damage to the cells. But if you are in the range, and that's not only Ligawave, that's the other systems too, which are used like Richard Wolf or like Storz or like EMS. If you don't exceed, let's say 0.6 or 0.8, and don't use more than 1,000 shots on one single point, you don't do damage on the tissue. Possible adverse effects of shockwave, sure, are, and that is with all the machines the same. You can cause a reddening, swelling. You can cause superficial hematoma under the skin, but this is all things that they go away within. Hematoma maybe in 2 or 3 days, but a swelling usually in 1 or 2 hours. No serious side effects if you use the shockwave properly. Okay.
Thank you. My questions from on site. Actually, I'm not a practitioner, but I think my questions suit marketing managers. Yeah, does I need to know that the Ligamed is the only one company that R&D and manufactured wide-focus shockwave therapy?
Yes.
Okay, it can be you. It can be you. It's okay.
Oh, it doesn't matter. I know it. That's a patent, a new patent, and that's the only company who has this patent. So wide focus, this technology is only by our company.
Thank you. And who is the leader brands for each of the shockwave? It's like for the focus and for the radio. Can you give information to me? I need to know who is the market leader for focus shockwave and who is the market leader for radio shockwave.
Maybe I can say a word to this. Yeah? I'm now working 40 years only with shockwave, and I think I have enough experience to say who leads or who not leads. First thing is, a leader depends on the country. Which country, leader or different shockwaves are in different countries more or less popular. It depends on the advertisement. It depends not only on the technique. So we, as Ligamed, we accept all our competitors, and we work also together with our competitors. We only, because of me, I know who is on the market, and I said, we as Ligamed, we don't want to make a Me Too product. We want to make another product only to help the user to have good results, and this is what we do. And therefore we explain our product, but we accept all other companies, we accept all other products, and it's up to the doctor to choose, not to us. The customer choose, and so I actually, like Irina said, we cannot say. It depends on the country, it depends on the doctor, on the buyer, and we cannot say this.
Okay, so it depends on the region's preference, right? Thank you.
Okay, now it's going on, and I give a little more details on the medical effects. Okay, later on in the workshop, I give you practical advice how to use a Shockwave machine, and it's not only for our system, it's for the other systems the same, and I am experienced in other systems too. But I will do this later on. Okay, what are the main indications? And in your hands out, maybe you have another list of indications, but we changed it because of that. There were some handouts where more rare indications are on the list, but this list shows you the most common indications for shockwave therapy. Calcifications wherever they occur, often in the shoulder, sometimes and at the elbow, often at the Achilles tendon, or in case of a heel spur. And the calcification alone is not the disease, it shows the disease. As I always say, it shows that there is any problem with that. Usually if you have, for example, a heel spur, you find this spur due to the problem that probably the patient's weight is too high, and due to the problem that he probably has, that his foot form, his foot arcs are not right, okay? So your body creates a spur there. The spur is not the disease alone, the spur is the sign for the disease, and the disease is there's too much stress on the insertion of the tendon. And it's the same with the Achilles tendon, and it's the same in the shoulder when you have, let's say, a calcification of the insertion of the supraspinatus. And if you do shock waves, I mentioned it at the beginning, but I want to repeat it because it's very crucial for the understanding. You don't crack these calcifications. Your body dissolves these calcifications, and with shockwave treatment, you improve the condition for your body to solve this calcification. Okay? In former times, the meaning was you crack the calcification, but that's not right. Okay, and that leads to the thing, if the patient complains about pain at the heel, you often don't see a heel spur, but he has the same symptoms. So he might have plantar fasciitis with or without heel spur, but the treatment is the same. You can apply shockwave. That's a thing. What I want to hardly stress on is don't use any tool, especially shockwave, not only for any painful point. Try to make a diagnosis, try to examine the patient, try to find out what is his disease, and then try to find a good therapy for this patient. And one good therapy could be shockwave therapy, okay? Treatment of trigger points is a very good thing, and just physiotherapists can add shockwave to their traditional manual or deep friction trigger point therapy, because with shockwave therapy, with a focus system or with a wide focus system, you can do an additional good treatment for your trigger points that you might not reach with your manual techniques. So you can add it on your manual techniques, and that's shockwave therapy is one therapy under other therapies, and you should combine it. Okay, these 4 indications: calcification, tendinopathies, heel spur, treatment of trigger points, are the classical indications. And if you go on the sites of the societies, that's ISMST, the International Society of Medical Shockwave Therapy, or the DIGEST, or Digest, but it's spelled DIGEST because it's German, the German and International Society of Shockwave Therapy, you find an indication list of proven indications, and those 4 are the most proven indications. Then the next 2 indications, wound healing and arthrosis or osteoarthritis, are indications where you can use shockwave, but the scientific work is ongoing, and there are not the recommendations like for the other indications. But especially, I can show you later. I especially have some experience for quite a long period of time to use shockwave therapy in wound healing, and it's a very good tool in some cases. Generally, shockwave therapy is a therapeutic mode than other therapeutic modes. That's not, let's say, the magical stick where you can heal everything. And all indications have some failure rate. But if you make a good diagnosis and you make a proper treatment, and you have a good indication, the failure rate is low. Okay, osteoarthritis. And then the other three indication groups, they are, let's say, under special scientific examination. And there are, up to now, no general recommendation for that. But there are groups, they try to improve the outcome of heart failure with shockwave therapy. There are urologists, they treat ED, erectile dysfunction. And there are neurologists, they treat Alzheimer's disease, or they treat other disorders of the central and peripheral nervous system, but it's too early to give common recommendations for that. Okay, now some clinical examples from my office or from my clinic. You see here the patient. It's an ulcer caused of chronic venous insufficiency. An old lady, 87 years, and we started with this here. With this was an ulcer, let's say 5 centimeters to 1.5, 2 centimeters, and the result was this. We treated the lady twice with shockwave therapy, only twice. One 750 shots and the other one 1,500 shots. That depended on the size. In wound healing, it's recommended to use around 250 shots per square millimeter of area of wound. Okay, so you saw this treatment like that. And if you do wound healing, you can do all the treatment you are used to do. You can do your surgical cleaning of the wound. You can put dressing on the wound. Whatever you do up to now to make the wound heal or to improve the wound healing. And shockwave is an additional point of therapy, and that was a good thing. You see, that was an ulcer lasting for around 2 years, and it didn't heal. And shockwave wasn't the only therapy. The wound dressing was the same, but it was done in the years before. But within a little more than 2 months, we could close this wound. And one effect sometimes you see, or you other therapists see too, that the scar, usually when you have an ulcer like this, you see a scar after that. Like you have a wound and it's sutured and you see a scar. And the wound healing with shock waves the result is no scar or better scars, maybe due to the thing that your body's abilities to close or to recreate tissue is enforced or enhanced by shockwave therapy. Okay, that's one example for wound healing. And this is hope, but if you don't, I show you. The X-rays of a young soccer player in Germany, football player. He got a clavicular fracture. That's normally no problem, and with this, let's say, easy fracture, you normally have you can do, or you cannot, you must not, or you should, or you can do nothing, and it usually heals within 6 weeks, okay? And this, I don't know why, and I didn't check why it was. It didn't heal. And 3 months after this accident in August, in November, I took this X-ray. There was some reaction of the bone, clear, but it was a young patient and had no other diseases. But it didn't heal. It's not only the X-ray, but use your hands, put your finger on the fracture site, and the pain is still here. And that's non-healing of this or delayed healing of this clavicular fracture. And this picture we took then, we did 6 settings or 6 treatments of Shockwave. I'll show you later the slice. And 4 weeks after the last Shockwave therapy, we took this picture. And you see where the fracture site was, but it was complete healed. And not only the X-ray, again, take your finger, put it on the fractured site, the patient had no more pain, so it healed. And this was the treatment on written, accident in August 2021, and healing confirmed at January 2022. And in between the end of November and the middle of December, we gave 6 Shockwave sessions 2 times per week, various mode, intensity 3 to 5, frequency. No, I think that's the wrong. I just mentioned it. We did it the wrong way. The frequency was 3 to 5, and the intensity was 4 to 6. I apologize. That's wrong. You have to do it the opposite way. Intensity 4 to 6, frequency 3 to 5. That's not much. You see, the intensity 4 to 6 is not much. Our system exceeds 25 steps, and so we only used step 4 to 6. And you mentioned there too, to treat the clavicular, you are in the near of the lung. And with this low energy, you never hurt the lung. You don't cause a pneumothorax. Trigger point treatment is a very interesting thing. As I told you before, you can use your physiotherapist techniques, whatever you want. And if you find the trigger point and treat this, you can improve your work. Let's say it like this. But you have to find the trigger point, and as you might know, people dealing with trigger points, the trigger point sometimes is not at that point where the heart muscle is, but it's anywhere else, and you have to treat this point then too. But if you feel the muscle that is hardened and you put Shockwave on this, you sometimes even under the treatment you feel that the muscle gets smoother and smoother. Okay, trigger point treatment is a good thing to use Shockwave for. Okay. You often see these slides with the questions. So if you have questions from here, from the room, ask me or ask Peter. And if probably there are questions online, we can ask them too. We can answer them too. The question online is, after Shockwave therapy, should the patient use analgesic or anti-inflammatory drugs? He can use it, but he doesn't have to, because the initial effect of the Shockwave treatment is like using a painkiller. It's I often have this information from my patient. For example, if I treat a heel spur, he gets out of my office and he says, "Doctor, I walk like on feathers or like on clouds." I hear it very, very often, and there is no immediate need for an anti-inflammatory or an analgesic drug, because immediately, or let's say some minutes after applied shockwave therapy, the pains are lower, and if they have pain, they can use. In the second part of the question was, if you use anti-inflammatory or analgesic drugs after shockwave therapy, is this bad for your shockwave therapy? That means, are the effects of the shockwave therapy not so good if you in addition use anti-inflammatory or analgesic drugs? I say no, but if you have a disease that causes pain at the insertion point of a tendon, like patellar tendon or like Achilles tendon, and the healing process is not ended, and you use anti-inflammatory drugs, you use ice, you use anything else, you don't give your body time to heal. So I recommend my patient, if I treat your patellar tendon, or if I treat your Achilles tendon or the insertion point of the Achilles tendon, stop sports that cause this pain within, let's say, 6 weeks or 8 weeks, in order to have a good result afterwards. Okay, sometimes I have professional players. What can I do? They don't have pain anymore, and they immediately start at sports. But the effect and the outcome in the end is not so good as if he would have had a pause. The athlete and the professional sportsman has a biology like you and me, and if a tendon is not right, or if the insertion point is inflamed or is partly ruptured or anything like that, your body needs time to heal. And the shockwave therapy, on the one hand, kills the pain, so he can start doing his sports again, but you need to give your body and your tissue time to heal. You don't heal it immediately by shockwave or by what else you do, but you have to give your body time to let it heal. Okay? Can you use shockwave therapy in diabetic patients and diabetic ulcers? I strongly say yes. That's a very, very, very good indication. And the diabetic ulcer profits takes the most profit of the shockwave therapy additional for wound healing. Diabetes is usually the problem with the microcirculation. It's like that if you have a so-called arterial ulcer, if you have your main arteries in the leg blocked, you can do shockwave as much as you want on the wounds, and it won't heal. Up to that moment, that comes blood again into this leg. Okay, that's no good indication. But diabetes makes a so-called disturbance of the microcirculation. The last small vessels are damaged, and those you can probably help to restore by shockwave therapy. And therefore, the diabetic ulcer is a very good indication. Okay? The second part of the question I forgot. The scars. That's a very, very interesting thing about the scars. Why don't you see so big or sometimes no scars? And the theoretical answer for that is that you, per shockwave or through shockwave, you probably activate stem cells, and stem cells are the basic for healing and restore tissue. And the meaning is, with the scars, that you not only heal the wound, like if you suture a wound surgically and you have a little scar, more or less, after that, but you give your body the means to restore this tissue, and so you don't see any scar, or you don't see only a little scar. That's the effect that you see. You can for sure use shockwave therapy on elder scars. If you have a disturbance, or if you have the so-called stria, I don't know if you know in Thailand what it is. If you, when you were pregnant, you're women, and you got a baby and you have those stria on your body, you even can try to treat the stria. And I don't want to say that they always disappear, but they improve in many cases. Okay? Okay. Yes, the question is if white focus can heal calcaneous heel pain. Yes, I think as Peter Vallon laid it out before, the good thing about white focus is that you should be, let's say, near the area or around the area where possibly the damage or the disease is. With the focus system, and especially the piezoelectric focus system, they have a lot of energy in one small point. And if you hit your disease or the target to treat exactly, then let's say piezoelectric shockwave is good for this disease. But if you don't know exactly, even if you have X-rays on the calcification of the shoulder, you make the X-rays and then you know there's about in this region, but you really don't know exactly how deep it is, and is it a little bit ventral or dorsal or lateral? And with the focused area, you have a volume. With the white focus, you have a volume with an amount of energy, so you can afford enough shockwave energy in a volume, not only in a point. Okay? So if you use, for example, the small tip, you can assure a volume of energy going up to 55 millimeters inside. And if you have a strong man or an athletic person and you want to treat calcification in the supraspinatus, you know it's around 3 or 4 centimeters in the depth. Then you go with the white focus, you know it goes deeper than 3 or 4 centimeters up to 55. You truly find the right region. And as I told you before, I don't stay on one single point with the white focus. I move a little bit. I will show you in the workshop how I do it. And so you can guarantee, or you can be relatively sure that you hit the target. More questions? Achso, du meinst die Bilder, die neuen Bilder?
Genau, okay. Einer hat es aktualisiert. Ich brauche ein bisschen Minuten.
Okay, you have your microphone, lady?
Yes, it's from bone healing. Yes, how much faster is it when you compared about we use the shockwave therapies and normal process? And normal process is like we didn't do anything with that case for the bone healing. Yeah, for how much faster?
How much was what?
Faster for healing process.
Okay.
Yeah.
Okay. Up to now, it's recommend, or Shockwave is a recommended treatment for delayed healing or pseudarthrosis. And how can you define that? In the medical field, it's said normally the fractures heal within, let's say, at least 8 weeks. If it heals after 8 weeks, up to 6 months, in medical field, it's called delayed fracture healing. And when the fracture exists more than 6 months, it's called pseudarthrosis, okay? So normally this fracture, this clavicular fracture, should heal under the normal therapy within 6 weeks. This, I say 95% of this shown clavicular fractures heal within 6 weeks. And there you can put a bandage on it or not. You can't put a cast on the clavicular, so you probably do have to do nothing and it heals. Or you can operate on it, you can put a pin inside to better the healing, but normally after 6 weeks it should heal. And so we started 3 months after the accident, and so per definition it's a delayed healing. But probably it would be good to add shockwave therapy at once for a fracture.
Yeah, thank you.
You can do it, you can try.
Yes, for bone healing too, for non-adult patients. Yes, it's like a young and child and teen. Yeah. That's the shockwave therapy that affect their growth modification.
The effect will be on every patient. On childs, childs have a better metabolism, and fractures heal faster. Up to now, there was no need to treat a child's fracture for me with shockwave therapy because they usually heal in the normal way. And if you have an old patient with osteoporosis, you can influence the bone healing as well, because osteoporosis means that the bone is weak or weaker than if you have no osteoporosis, but the healing process is the same as if you don't have osteoporosis. So it doesn't belong to the age of the patient. It's why does some fractures heal? Why does it not heal? There are a lot of reasons for that. Maybe it's not stable enough. Maybe there's a distance. Maybe there's tissue in between. But to be young or old, yes, it affects bone healing, because in childs under 10, especially, the bone healing is much faster than if you are elder than 10. But in elder persons, it heals as well.
Yes, very clear. Thank you.
The effect of shockwave therapy on Alzheimer patients. Up to now, I personally did not treat any person with Alzheimer's disease, but I saw some, which colleagues of mine did treat with shockwave therapy, and to be honest, I personally didn't see any improvement up to now. But I know there are machines and they have devices, and they therefore to treat Alzheimer's disease. I personally think that and these devices are like that. You wear like a hat, And the shockwave, I don't know from where they come, but they come from everywhere on the head. And I don't know how you place enough gel on it, but you should need gel as well. But those devices, I know they are on the market. But as I say, for shockwave, try it. But I personally have no. I didn't treat a patient, but and I saw patients treated by shockwave, Alzheimer patients, and I didn't find an improvement. But there are theories, and not more than theories, because there are trials, scientific trials, that shockwave might influence restoring and healing of nerval tissue as well. They in the University of Innsbruck or in Austria probably they cut ischiatic nerves in rats, and they sutured it again and put shockwave on it, and the sutured nerve is sciatic nerve in the rat, which had additionally shockwave, healed very much faster than if you didn't use shockwave. But are we rats?
One more question. How about ED?
ED?
Yeah, okay. ED. The most successful treatment now.
There are, let's say, promising results in treating ED with shockwave therapy, as well men and as well women. And I'm no urologist, and in Germany usually urologists treat ED, but that's very, very multifactorial disease, okay? If the disease is caused, let's say, by disturbance of the blood flow, I can say there should be an effect of shockwave therapy using it in this disease too. But as you know, ED has psychological reasons and things like that, and I don't think that you can heal this by shockwave therapy. But again, if you have a machine, if you have the problem, if any of your patients has the problem, try it. Okay, here, let's see.
Could you please explain more the shockwave therapy that you use with the wound healing? Because it's an open wound. Mm-hmm. Do you need something to cover or the gel?
Very good question. Yes. You have an open wound and you should treat it sterile, right? Okay. So the practical thing is like that. I think you must have it in Thailand too. In Germany we have a so-called sterile gel. I don't know the name of yours. Ours has, the name is NUK gel, N-U-K gel. And that's a mean to treat open wounds with or without shockwave. And you can use this gel, you put it on the wound, and then you cover this wound with a foil, a sterile foil that you probably use in the OR, in the operation theater, okay? And then you have a sterile field, and on this foil that covers the wound with the gel, you put your normal shockwave gel on, and then put the shockwave, apply the shockwave. That's how you treat these open wounds.
I see in online. Okay, one question in online.
Does shockwave have any effect of muscle spasm? Yes, it has. You can treat, let's say, torticollis or something like that with shockwave therapy. You can do it, and it has a good effect, and you treat it. You do the treatment similar to the trigger point treatment. You find the spastic part of the muscle, and you apply shock waves. If the underlying problem is a thing like, let's say, a strike, any permanent nerval damage, you can cause an effect which is lasting for days or weeks, and then it occurs again, then you can apply again shockwave. There are some researchers, I'm very careful, and they say they see an effect even in those cases to restore the nerval situation. But I personally, I'm very careful to make a recommendation for that. But if you have any spastic muscle, you can use shockwave. I think there is almost at all cases there must be an effect. I think so, but I don't think that it lasts very long. But there's no, you can use it again if it helps your patient. But I had cases of torticollis, and that's normally no neurological problem, and you can help the muscles relax by using shockwave therapy. Yes. Okay. Yeah, and okay. One attendant wants to have repeated the medical effect of shockwave therapy. Do you still have this? You have? Is it on? I can go back. Or no, you put it on the. Yeah. I show you again this slice of the medical effect. No, I'll go back. I think the questioner wants to see this slice again. Otherwise, you have to write if you want to see the specimen, the real, the petri dishes with the fibroblasts on. Okay, shockwaves induce cellular reactions to, that's called the mechanotransduction. If you apply shockwave at any kind of tissue, you will give an mechanic stress on this cell. And it's comparable to your friction therapy, deep friction therapy, or it's comparable to do any sports activity that's that's mechanical stress on the tissue. What happens if you go repeatedly, do jogging or things like that, you get better, or cycling, you get better muscles at the legs. Okay, why? The mechanical stress of sports activity makes the muscles grow. Okay, and shockwave is a similar effect. If you treat the cells with shockwave, they react, and this reaction is meanwhile measured by biochemistry. There are a lot of papers who show that there's an effect, and I think it's proven that shockwave activates mesenchymal stem cells. Stem cells, there are in bone marrow and in other types of tissue in the body, and the theory is like that: if you activate stem cells, they go or migrate to the site of the disease, or to the site of the defect. And the so-called mesenchymal stem cells, they can restore mesenchymal tissue. Okay, and if you can activate those, you can heal tissue, and that should be the reason. Because sometimes, not in all cases, you don't see scars, or the scars are not, don't have a healing in the classical way, but you have a restoration of the tissue. Okay, dissolution of calcifications that goes in the same direction. You don't crack the calcifications, but you help your body to dissolve this. And with this, you can see more vessels, and you have a better blood flow. But it's like that. Some diseases and some inflammatory diseases, like for example, achillotendinopathy. If you examine an Achilles tendon with achillotendinopathy by X-rays, or not by X-rays, by ultrasound, you can see that if you have you feel the swelling of the Achilles tendon, and if you examine it, you find that there are more vessels inside, because that causes, or the effect of the inflammation, whatever cause of this inflammation is, too much use of the Achilles tendon, to high weight or anything like else, it causes more vessels in this tissue. And if you treat it with Shockwave and the disease is healed, you have normal vessels, less vessels than at the beginning. So new building of vessels is not in all cases a sign of healing. Sometimes the reduce of vessels is a sign of healing. Okay, and this antibacterial and anti-inflammatory effects might be the same. If you have an infection, if you have an open wound, the body tries to close it, and has to get rid of bacteria that are inside. And you might help with Shockwave. There are some findings that goes in that direction, that you find less bacteria. If I don't want to say that Shockwave kills bacteria, but it helps your body to kill the bacteria. That might be the way. I hope I answered the question, but the questioner probably ask again if I didn't hit it.
ในออนไซต์มีคำถามเพิ่มเติมไหมครับโอเคในออนไลน์ก็น่าจะไม่มีอย่างนั้นวันนี้เราน่าจะได้พักเที่ยงกันเร็วนิดนึงโอเคครับถ้าอย่างนั้นถ้าไม่มีคำถามเพิ่มเติมนะครับในช่วงเช้าเราได้พักกันเร็วนิดนึงนะครับก็อย่างนั้นเดี๋ยวขออนุญาตพักเที่ยงนะครับสำหรับออนไซต์นะครับมีข้าวทานเรียบร้อยนะครับรับทางด้านหน้าได้เลยนะครับสำหรับออนไลน์ครับเราเจอกันใหม่อีกทีตอนบ่ายโมงตรงนะครับขอบคุณครับ